This is Ortega Live Weekly News Edition. I'm Sule, and here is our themes of the day. The coronavirus didn't really go away from the Comoros. New cases surge, especially in the island of Moheli, where some deaths are being counted since the previous weeks. Greetings, dear viewers. Today we talk about the coronavirus in Moheli, how hard and complicated the situation is. It is even worse than when COVID-19 firstly hit Comoros. Haina with the details.
New cases of COVID were found in Moheli 3 days after President Azali lifted all restrictions on social gatherings. At least 9 deaths were recorded, including the death of Mr. Zuberi Hassan Ali, mayor of Fomboni, capital of Moheli. The death occurred on Wednesday and his funeral took place on the same day in the evening. The island governor Mohamed Said Fazul and his cabinet ordered a new lockdown as COVID variant spreads. They also imposed new severe social measures, including a curfew. Trading between villages is banned. Nobody is allowed to go out except for basic needs and medical emergencies. The curfew begins exactly at 6 o'clock. Markets open from 6 a.m. to 4 p.m. The army is in every corner of the island, reinforcing safety measures. On Wednesday, 7 people who came from Moheli on a small boat coasted on Male, a small village in the south of Ngazija. They were all arrested by coast guards and reported to the health authorities, who made sure they were all tested for COVID. Fortunately, none of them tested positive. However, moving forward, it was decided that security will be reinforced on all coasts.
It is sad that many people in the village of Mwangoma, Moheli, don't believe that the virus is here. We as a youth association are working hard to prevent people from getting sick. We make sure people wear masks, wash hands and stay home, especially the elders who are at risk. We have counted 9 deaths so far, and we would love this deadly disease to disappear. This can stop only if people listen to us, for God's sake. Our crew stays on the village borders to prevent passengers from entering in the village. To be permitted to enter in the village, everyone is required to wear a mask, wash hands, and not present any COVID-19 symptom. We collect our own money to buy disinfectors to disinfect public surfaces and car doors in car and bus stops. Sometimes we stop cars on the street to do so. We also buy buckets, fill them with disinfection water, and put them in public places for washing hands. We didn't get any financial help from the diaspora or the government. It is just a social contribution for anyone interested. Hopefully, this deadly virus will go away the quickest possible. Amen. I personally agree that the virus is here, and I thank the army, doctors, youth associations, and others for doing a great job in protecting us from this disease. However, the army is sometimes exaggerating. They don't want us to die from the coronavirus, but we're going to die with hunger and stress. It is a total lockdown here in Moheli. We're not allowed to go to our farms to get some crops. We're not allowed to go out to make business. All the army wants is to stay home. I mean, how are we going to feed our families?
Some people in Ngazija don't believe that what is happening in Moheli is real. They say that all what's happening in Moheli is a government scenario.
I don't believe that there is coronavirus in Moheli, or let me put it straight. I don't believe that there is coronavirus in Comoros in general. See, what's happening in Moheli right now is possibly all prepared. What if the country is funded by an international COVID-19 sponsorship or want to be funded? The only way to prove funding expenses is by maintaining that the virus is here and people are dying. Anytime there is a person in Moheli who naturally dies, people attribute his or her death as a COVID victim. Wouldn't that even be possible that some of these people could have possibly been strategically killed? Who knows? We are living in a strange Comoros in these last couple years. It is possible that the government want to preserve this sickness so they get vaccines from abroad in the upcoming months. For what reason? You know what? I don't even know what to say.
The Minister of Health keeps warning the population that coronavirus cases increase every day in the country. Let's get the latest COVID updates from the Ministry of Health.
This chart represents the last updates from the Ministry of Health from January 3rd to January 5th. As you see in this chart, we have 6 deaths in Gazija, 2 deaths in Nzwani, 5 deaths in Moheli, and then in total we have 13 deaths. But these numbers have increased because this is for the previous week, but we know that last Sunday in Moheli itself we had 6 deaths on the same day, and the number of new cases is still increasing every day. So the Ministry of Health keeps sending messages through mobile phones to warn the populations to take their responsibilities to prevent their families against this disease. But it seems that nobody wants to believe that the virus is here and new cases still surge every day. Hopefully in the coming days and weeks, the population will understand and accept the government instructions to take their responsibilities to protect themselves and save lives.
Certain people in Gazija definitely accept that there is coronavirus in the Comoros. Some of them experience similar COVID symptoms, but they can't really say that they are positive. 2 of them have agreed to talk to us.
I don't understand myself in these last couple days. I sneeze a lot, I get some fever, sometimes I cough, but I can't really say I have the virus with me. Every day I take some lemons with honey as for a relief. Late on the days I go swim in the ocean. I feel better then.
It's strange that everyone you meet these days says that he or she suffers from headache, cold, and fever. I'm really afraid we have coronavirus here in Gazija. It is not because we don't die every day that is not around. The virus is here. Let's protect ourselves from this virus, please.
I wish people would listen to us. We're going through a lot here in Moheli. We receive a lot of new patients every day, and we see them die in front of us. It's hard. You can get infected if you don't respect the safety measures. So please, stay at home, wear a mask, wash your hands, and respect social distancing. Coronavirus doesn't care about your social status or whether you're young or old, rich or poor. Anybody can get infected. We're running out of beds, medical equipment, and drugs at the hospital. We don't get enough food and enough medical equipment for everyone. So how are we going to survive and take care of all these patients?
Thank you for watching. That was Ortega Live English News Edition. Hopefully the situation in Moheli gets better soon. Please stay safe. See you next week. Bye bye.